Hi, everybody. This question comes from our monthly Ask Dr. David live series. Hope you find it helpful. What is the current status of respiratory syncytial virus, RSV, spread and severity, and how can I protect my kids? Okay, so let me first talk about severity. RSV is RSV. Whatever is going around now is not more severe than previous year's RSV. Yes, it's true that there is a more likely chance of a young child to catch RSV because of the fact that if people were in more of a lockdown, um, in home, wearing masks, not socializing, there were a couple years where just the virus wasn't spreading. And so we have all of these susceptible young children that are getting hit all at once. So as far as the disease itself is it's a bad disease for some people, for some children. It's also being seen bad in elderly people as well as older people as well. But we know that for most people, RSV for children, it's a cold, can be a bad cold, and sometimes it goes on to bronchiolitis, which is inflammation of the bronchioles, the smaller airways, before we get to the alveoli, the air sacs. We know that it can lead to a pneumonia. We know that people are being hospitalized for it. We know that the hospitalizations for this is much greater than it ever was for children at any point during COVID as well. Now, in terms of the spread, again, that's kind of where we were talking about from that. And then how can I protect my child? So the protection, there's nothing specific about the protection of RSV unless there was a premature baby or a young baby who has lung disease, where there is the injection that's given of the gamma of the immunoglobulin, the IgG against RSV. So it's kind of like in a way you can think of like a monoclonal antibody, and that can protect people who are at risk. The general population, there's no vaccine for this. They're talking about putting a vaccine together. Of course, we'll see where that goes. But obviously, all the other things we've ever talked about in terms of how do we stop viral spread. Don't be around people who are sick. Don't be, even if they have a cold, because they may not have turned into the bronchiolitis or the pneumonia. The hand washing that we've talked about, open spaces, ventilation, not being in clouds, not being on top of each other. If a person is also an at-risk person themselves, wearing a mask, especially like a well-fitted mask that's more KN95, N95, realizing that a lot of children wouldn't be able to do that for obvious reasons. But those are, of course, are ways that people can be protecting their kids as well as anybody for that matter. How can you tell the difference between RSV, COVID, and the flu? Well, the most assured way would be a test. And a lot of the labs, we use a lab here that can check for all of those, influenza A and B, along with COVID and RSV, so that if a person does have symptoms, that a swab will be able to, one single swab now can actually tell that information. They're not rapid tests, and of course, if a rapid test were to be done for flu or for another virus and COVID, etc., and it shows positive, then of course that would be a way of knowing what you have. But there can be some differences relative to the symptoms. Okay, if a person is having more of a wheezing like symptom, more likely it's RSV. If a person starts off with just more of a general cold that kind of goes into some of those things, that's where RSV can be. That's where COVID could be. If you get hit like a truck, where all of a sudden, bam, you are just floored, whether it's extreme fatigue or aches and pains, severe headache, high spiking fever, that's more likely influenza. But para-influenza, which is another virus that we didn't ask about here, but para-influenza can cause all of the same symptoms as the flu. That's why they call it para-influenza. And of course, there are a myriad of other viruses that are out there as well. But those are really some of the things. Now, why would a person want to know whether they have one of these things? Realistically, the main reason would be if they were interested in taking a viral specific medication. So if you had the flu and you wanted to, and you would take Tamiflu if you were positive, of course, and you really should be checked within 48 hours for that. If a person has COVID and they want to advance their care by taking Paxlovid, which needs to be started within 5 days of start of symptoms, and that would be another reason why you would want to check. But if you're the type of person where you're just going to kind of play through it, I know that I am sick, I'm not going to be around other people, I'm going to have to avoid my holiday or whatever with the family because I'm sick and I don't want to be exposing anybody, then the most important thing at that point is looking for and watching for severe symptoms: difficulty breathing, shortness of breath, rapid breathing, really feeling way out of it, mental status changes. A couple of times when I've caught influenza, I've literally gone encephalopathic. I've had ringing in my ears. It felt like my brain was on fire. I really couldn't have really good conversations with people. I was really just messed up in my head. That's the reason why I do choose to get an influenza vaccine every year. I've handled the vaccine very well back in my medical school and residency days. In all honesty, I would do that every year versus the couple of times when I just went so bad with influenza. That's an easy thing for me. For me, COVID was a walk in the park compared to influenza. I do not want influenza ever again. Of course, my own self being a pediatrician, I've been around so much RSV in my life. I would imagine I have to have super, super duper immunity against RSV. But of course, that's me because of my job. I would imagine a lot of elementary school teachers or preschool teachers probably would be the same way when it comes to RSV as well. But, knowing those differences, it really kind of depends. But whatever you're going to do, what are we going to do? Start our immune protocol. Start that vitamin A right away. How are we going to try to minimize the disease? Have good vitamin D and zinc levels. All right. I know I'm sounding like a broken record, but there's a reason.